All right, this is Pharmacist Interventions part 41. I had a caregiver trying to fill a prescription for Flexeril 5 milligrams twice a day, and I saw that the patient was in their 90s. Anytime I see someone trying to fill a prescription that can cause like sedation and dizziness in a patient of higher age, I always counsel on falls. The caregiver told me, well, that's interesting because she fell 3 times last week. I was like, 3 times? And then I was like looking at her med list to see what else would like increase the risk of falls in this patient. I was like, oh my God, she's also on a blood thinner. She's on Eliquis. That always makes me nervous when I have a patient who is falling and on a blood thinner. That's a huge risk for an internal bleed or hemorrhage. Not to mention falls already in elderly patients is a risk for fractures and subsequent mortality. If you're interested, here is a list of risks for falls that we learned in school. We've got something called the Beers list, or the Beers criteria. This is a list of medications that helps clinicians identify potentially inappropriate medications that should be avoided in like older adults. You can find this list online for free. Scroll down, you'll see that cyclobenzaprine is on this list. It's recommended to avoid these medications, and the strength of recommendation is actually strong. Quality evidence is moderate. This is due to its anticholinergic adverse effects, sedation, and increased risk of fractures. This patient was also on Lasix and amlodipine, so I said monitor the blood pressure, make sure it's not dropping too low if she's getting dizzy. Also briefly mentioned that Lasix also decreases the amount of calcium in your body. We need calcium for strong bones. With this one, I recommended that the caregiver follow up with the providers about the plan of care with all of these medications on board and what's causing her falls. The caregiver decided to hold off on the Flexeril until they got pulled with the provider. My next intervention, I had a patient picking up Addie. This is flibanserin. It's for hypoactive sexual desire disorder. It's for premenopausal women. I was checking her out for the prescription, and when I check people out for prescriptions, I like to counsel them real quick and just be like, oh yeah, make sure you don't drink alcohol with this one. And she was like, what do you mean? That is the main counseling point for this medication. I will add, there's also the black box warning. I'll say that you don't need to avoid alcohol completely, but you need to wait at least 2 hours after consuming 1 or 2 alcoholic drinks before taking flibanserin at bedtime, or skip the dose if greater than 3 alcoholic drinks were consumed that evening. This is due to the risk of severe hypotension and syncope, which is fainting. This patient was also missing a second important counseling point. It needs to be taken every day. She thought she was supposed to take it as needed, like Viagra or something. We assess efficacy at 8 weeks or 2 months after you regularly take it every day. I just thought that was interesting because those are like the 2 main counseling points on this medication, and she had no idea about it. I don't think she even knew that she was picking it up. I think she was surprised that it was ready for pickup. I don't know if she had a conversation with her doctor, or maybe they just sent it in and didn't tell her about it, but I just thought it was weird.